Hello, everyone. I'm John Schmidt, Senior Vice President of the ACO Exhibit Hall, and welcome to this week's Exhibit Hall Flash interview. This week, our guest is Kevin Sheldon, who's the Chief Operating Officer of CareJourney. And just a quick overview, CareJourney is one of our exhibitors that specializes in providing healthcare organizations, including ACOs, some relevant analytics that are very helpful to manage networks, improve provider performance, gain population management insights, and just many other kinds of solutions that Kevin will tell us about in a minute. So welcome, Kevin.
Thank you very much, John. Thanks for having me.
Yeah, absolutely. Glad you could join us today. So I've just got a couple questions that I want to ask, and then I'll turn it over to you, and I think our listeners will find this session very helpful. So let's start with what services or solutions are offered by CareJourney to help support ACO operations, and then when you're kind of finished with that one, what sets CareJourney apart with respect to what other companies are offering in similar services?
Yeah, no, thanks for the question, John. I appreciate it. I think probably what I would preface my answer with is just a quick background on what makes CareJourney special, and then how we use it to serve ACOs. So CareJourney was founded under the belief that organizations were not leveraging a massive asset of open data that the government has been releasing over the years, as well as research around how to deliver better care that, again, the government has been releasing. Many of these things coming out of the launch of the Affordable Care Act to kind of innovate on data and insights. So CareJourney has done a lot of work to gain access and leverage insights from a massive database of Medicare, Medicare Advantage, and Medicaid claims from CMS. We have almost 150 million lives of longitudinal data, much of which, especially the fee-for-service data, is updated at least quarterly. And then we also have coded up a pretty expansive library coming out of CMMI about innovative ways to deliver care models to better help patients. And we use all of those, that massive data asset and the kind of these clinically relevant care models, to serve ACOs in three main ways. One is network design, the other is performance management, and the third is clinical excellence. So I'll just talk about each of those three quickly. From a network design perspective, we use the access that we have to 100% of the fee-for-service claims to score providers on a cost and quality scale. And we score them on a 1 to 5 scale by basically benchmarking them to their peers. So we'll benchmark oncologists against other oncologists, cardiologists against other cardiologists within a market, obviously knowing the dynamics of each market are unique. Our ACO members have then used this provider performance index, as well as hundreds of other metrics that kind of support it and provide the foundation for it, to curate a successful ACO network, including PCPs and specialists. And we can also demonstrate the referral patterns and the relationships between those PCPs and specialists. So whether it's recruiting top unaffiliated providers in a region or refining a preferred referral network within an ACO, our members really use our provider profile and referral modules to drive that decision making. On the performance management front, we derive key metrics to benchmark every ACO in the nation against each other, because we have that national data set. So you can compare key financial, utilization, care model compliance metrics, not just against a national average, but against select competitor ACOs as well. So you might want to dive into annual wellness visits and see that they're 10% lower than a region, or 24% lower than a competitor ACO, or something like that. You can dive into our product and identify differences, understand the nuances between certain practice groups and PCPs, and use that to kind of triage and move to best practices. And then the third and last is clinical excellence. So while we have this national database to provide market intelligence, we also can ingest an ACO member's claims into our analytics, which can then take the analytics on care interventions and things like that and really drill it down into the patient level. So we've helped members determine the optimal amount of therapy services for the frail elderly, for example, to reduce cost of care. We've tested care interventions on cost and quality across several patient conditions, including congestive heart failure, UTIs, a variety of particular conditions and particular programs. So I would say we're very proud of how we've been able to serve ACOs. Our unique access to the full Medicare fee-for-service data set complements our claims ingestion work to really lay out the full picture of performance and growth for ACOs. And we're thankful for our ACO members in our cohort to date, and hope that we can continue to grow our CareJourney membership family and share best practices across those ACOs.
Wow, Kevin, that's a lot. And, over the years that I've been able to work with CareJourney through the exhibit hall, I got to tell you that we're very impressed by the amount of resources that CareJourney makes available, white papers, webinars, just a lot of resource information. And a lot of that just comes free. I mean, to anyone that wants to access it. And that's, that's very significant. So we want to encourage everybody listening to visit the CareJourney booth in the ACO exhibit hall. There's some downloads that I think you'd find very valuable and helpful there. Check out the overview and you get a deeper insight into what Kevin's just talked about. Go to visit the website. There's just so much there to absorb. Hard to get across all that in 5 minutes, but I think you did a great job, Kevin. So thanks to everyone for joining us. And I want to say a special thanks to you, Kevin, for just doing a great job today and helping us gain a better understanding of CareJourney.
Yeah, so, thank you very much again. Thanks, John.
Yes, absolutely. So bye now to everyone, and please stay safe and well.